Well, a decision on lockdown in Melbourne is expected today as health authorities scramble to contain the current COVID-19 outbreak. 15 cases and wait times of up to 3 hours reported at testing sites yesterday. Some doctors are concerned the city is not prepared already. This morning, live on our program, we've seen cars lined up for a long way already, an hour before those clinics open. For more, we're joined by Director of Emergency Medical Training at Royal Melbourne Hospital, Dr. Emma West. Doctor, good morning to you. You witnessed emergency rooms reach capacity last year. Are hospitals ready for a repeat?
Oh, absolutely, we're ready, Karl. Good morning. We're well trained. We're ready to upscale should this outbreak get worse. We're also just standing right next to the testing clinic, which is running at full capacity. There's people lined up already, and we run that very efficiently. And really the message to Victoria is to get tested immediately if you have any symptoms, and really for us all to move forward in getting vaccinated if you're eligible to do so.
There has been some concerns about hospitals not being ready, anecdotally, and also in some of the newspapers today from some people. Are you concerned about hospitals not being ready at this point? Because I think that was a shock to most people.
No, I think we are ready. We had a tremendous amount of experience from last year. We're very well trained in terms of protecting patients and each other with all our PPE training. We know how to do that. We can do that with our eyes closed. We're also ready to upscale our emergency departments back to respiratory EDs and normal EDs so to split those patients if we need to. We're just ready no matter what happens with this outbreak, but I'm really hoping that it won't become any, a big deal like it was last year, because seeing multitudes of very sick patients is just awful. So, the message is get tested and get vaccinated. The vaccine is safe.
Have you seen in the last 24 hours to 48 hours more people coming into emergency? Have you seen more numbers on the ground?
We've been really, really busy over the last few months. Our numbers, probably as a consequence of lockdown last year, are huge.
Are they?
But in relation to seeing patients with COVID, we're not seeing any. We're not seeing any patients with COVID, clearly. But should that be required, we are ready. There's no doubt about it. We've got all our processes in place. We're well trained, and we can look after patients with infectious respiratory illnesses no matter what.
We just saw Izza, our reporter, interviewing someone who was lined up already at one of those testing clinics in Melbourne, and you can really feel the anxiety that they're going through about trying to get to a location where they can actually get tested. Psychologically, this is hard, isn't it?
I think Melbourne went through a really difficult time last year with that prolonged period of lockdown, and I think it's all coming back to the front of our minds now. It certainly is for me and my family. And I think swinging back into action and getting tested with even the most mildest of symptoms is what we can do, and we do it really well. And so, that's what I want to say to people. If you're sick or you've been to an exposure site, get tested. There's already people getting ready for when the doors open at 8 a.m. behind me, for them to get tested. They're doing the right thing. And so I would hope that Melbourne is well placed to get in control of this current outbreak quickly.
I think that's reassuring. Dr. Emma West, and you can catch her in Emergency, Mondays, 9 p.m. here on 9. Thank you so much for your time today, and best of luck. Appreciate it. Ali.
Well, as Melbourne stares down the barrel of yet another potential lockdown, concerns are being raised over the state's preparedness. In particular, the vaccination of our aged care residents and workers. Minister for Senior Australians and Aged Care Services, Richard Colbeck, joins us now in Canberra. Richard, thank you so much for your time this morning. There are 29 aged care facilities in Victoria yet to receive a single dose. Why not?
Well, they should be done in the next few days. We've prioritised those, and we've been working our way, obviously, across the country. There's nearly about 600 facilities that the Commonwealth has responsibility for in Victoria. As you said, 29 of those left to be done. They were programmed to be done in this week or next week, so we'll get those finalised as quickly as we can. And we're actually going back over other facilities, particularly in those areas of Melbourne where there has been an outbreak. The average vaccination rate across aged care in Australia is about 85%. There's some that are lower than that. So we're going back and offering people a second chance to take up a vaccine if that's what they'd like now, given the current circumstances.
I mean, these facilities in Victoria haven't seen a vaccine yet. As you said, they'll be prioritised. It, seems to be coming a little bit late. We are talking about our most vulnerable citizens here. They've been eligible for more than 3 months. We know supply hasn't been an issue. So what's the explanation?
Well, there's 2,580 odd providers across the country. There's 183,000 residents. So in about 12 or 13 weeks, we've done nearly all of those. We should be finished this week or next week, all of those across the country. It's a significant effort by our providers that are doing that. I think they've done a good job. They've done it very smoothly. Largely, there's been the odd challenge along the way, but we've dealt with those. We've had to reprogram some because of flu vaccinations, and that's the circumstance with some of these facilities. They've programmed their flu vaccinations in, and we know how important that is as well. So it's been a significant logistical effort, and we've been working methodically our way through it with a really good workforce that have done a great job, I think. And as I said, we should have them finalised in the next week or so.
Do you think it's acceptable, though, that we've got people in aged care facilities, we've got staff who are moving between some of these facilities who are still not have had their first dose?
Well, the important thing is the residents, Ali, and that's why we've prioritised them. And as I said, we've just about got those done, and we're going back to offer people who decided or didn't give consent in the first circumstance to take up the opportunity to have the vaccine now. And
have we just been a little bit too relaxed, though, because we haven't had COVID in the community?
Not at all. Can I tell you that Minister Hunt and I have been working very closely with our departments, meeting several times a week to understand where the rollout's at, which facilities are being done, what are there any issues, all of those sorts of things. So we've been on this the whole time, maintaining close contact with our departments to ensure that we maintain momentum. And of course, as we've had to reset the entire rollout because of the advice, particularly with respect to AstraZeneca, we've opened up additional channels for people to access vaccine, particularly the staff. So this has been a very live exercise all the way through, and Minister Hunt and I, and in fact the Prime Minister, have been very closely keeping an eye on this all the way through, because it's really important. We want people to go and get vaccinated.
We've now got an outbreak in Melbourne. We don't know how bad it is going to be, hopefully not too bad, but we're looking at close to 80 exposure sites at this point. How would you feel as an aged care resident in one of these homes in Victoria if you haven't had the jab? How do you think they're feeling right now?
Well, some of them have chosen not to take the jab, Ali, which is, I find, a little disappointing, but it's been their choice. We continue to work through the rest of the sites. We've prioritised those, as we've said. We've opened up a number of channels for the workforce to get vaccinated, and we're going back over sites where people have chosen not to take the jab to see whether they want to take it up given the changed circumstances. But I have to say that the one thing that really did comfort me was when I rang the Victorian Aged Care Recovery Centre, which we established last year during the peak of the second wave, is that had already kicked into action. They were already in touch with providers in the areas where that had been identified as outbreaks. They were making sure that their PPE supplies were strong. They were checking on their COVID outbreak plans. So all of the systems that we put in place last year to deal with the COVID outbreak we had in Victoria had kicked into action before I even made the call. I asked for some additional information, which is now being provided to me on a daily basis. So the systems and what we learnt from the outbreak last year have very quickly kicked into place. So there is, and most people, a large proportion of them, have had their vaccination, so that we're in a much better situation than we were last year.
Working at these facilities who have not been vaccinated as we face another outbreak. That's the headline, I guess, isn't it, this morning, that we're looking at?
Well, if you look at the statistics, the people that are the most vulnerable are the residents, and that's why we've prioritised those, and we should. Tragically in Victoria last year, we lost, 655 residents of aged care in Victoria, and they're the ones that are vulnerable, and so that's why we've prioritised those, and we make no apology for doing that.
OK, thank you so much for your time this morning, Minister. We appreciate it.
Yeah, just
Thanks,
back
Ellie.
to those live shots quickly in Victoria right now. Our reporter Izza was there a little bit of time ago, and as you can see there, look, it is still at least half an hour away from opening that particular centre at Albert Park in Melbourne, and as you saw before, there is a great deal of anxiety amongst those people lining up in just finding a place that was going to be able to handle the workload of those testings this morning in Melbourne. Trying to find a place where they're going to be able to cope with the load is difficult. We'll come back to Izza and those people and those lines. It's going on and on and on, as you can see this morning, just building the tension right across Melbourne this morning. Back to there soon.